So this lecture will cover Chapter 2 in your text. Chapter 2 is entitled The Well-Being of the First Responder. I think that as we move through this chapter, I think it's important to have in the back of your mind the demands that are going to be placed on you as an emergency medical first responder, and that these demands really truly can be significant. Typically, the demands are physical in nature, so you're lifting someone, or you're moving someone, or you're helping someone. However, the two most underestimated demands on the emergency medical responder truly are emotional and mental in nature. And so that when we think about the well-being of the first responder, not only do we have to think about the physical attributes, but we also have to think about the mental and the emotional component that's assigned to it. I think that in order to meet these demands, so physical demands, emotional demands, and mental demands, that you truly have to take care of yourself. You have to do this by making healthy choices that promote your own physical well-being, and these choices will benefit not only you, but also the patients and their families that you assist. So in order to help prevent disease transmission, you first have to have an understanding of how infections occur and how diseases spread from one person to another, and what you as the emergency medical responder can do to protect yourself and others from disease. So I think it really starts with the definition of a communicable disease or an infection disease, right? And so we think about a communicable disease, we think about a disease that can be transmitted by people, objects, animal, and or insects, right? So when we think about getting an infection, I think it's important to understand that it's not just people that can transmit diseases, that it's also an object that we touch, an animal that we interact with, or some type of insect sting and or interaction. So how are diseases caused? Well, they're caused by an invasion of a pathogen, right? And the two most common pathogens that we think of or that come to mind are the bacteria and the virus. But the other two pathogens that we also have to take into consideration truly are fungus and parasites, right? So what is a pathogen? Well, a pathogen is really truly just a small disease-causing agent, right? And this small disease-causing agent overpowers the body's defense systems, and it causes some type of illness and or infection. So bacteria and viruses cause most infectious diseases, so we'll spend the majority of our time talking about these two different pathogens, and we'll really start with the viruses first. One thing that we know about viruses is that they depend on other organisms to live and to reproduce, and so because of this, viruses cause many diseases, including like our common cold, right? So when we're coughing or we have a runny nose, and that cold goes away within a specific time period without having any medication, right? The big obstacle to having a virus infection truly is that with the virus, that once it's inside of the body, sometimes they become difficult to kill. And so sometimes we actually need to have our patients take antibiotics if, in fact, they do become infected with some type of virus, right? They're very difficult to kill. And while there are medications that can kill or weaken the virus, the body's immune system typically is good at killing or destroying most viruses that enter our body. So it's very rare that you would have an antibiotic prescribed for virus infection. On the opposite end of the spectrum, we have our bacteria, right? And our bacteria are different than our viruses because they are everywhere. They are on surfaces, they are on door handles, they are in your dorm rooms, and they do not depend on other organisms for life and can live outside of the human body. So what does that mean? It means that we're most exposed to bacteria and bacterial infections, right? The interesting thing and the cool thing is that most bacteria do not infect humans, right? So that's a big deal. However, if they do for some reason infect a human being, then most of the illnesses typically are very severe. So I think of like a bacterial meningitis, and as you can see from the list below here, that you get your strep throat, and if you've had strep throat, you know that that is a very painful condition, right? And so typically your immune system is not strong enough to kill off the bacterial infection. So in fact, antibiotics are prescribed. And so some of the most common antibiotics that we'll hear about are, your penicillins, your erythromycins, and your tetracycline, right? Tetracycline typically has been used also in the treatment of acne. So the body's ability to fight off infection really truly depends on your immune system. Is it intact? Is it compromised? What is going on with the immune system? So basically, in our healthy individuals with healthy immune system, a bacterial infection is often avoided because our immune system is so strong that it typically can fight off the infection, right? And so when an infection is present, if we have a healthy, intact immune system, it is capable of killing off the bacteria or at least weakening it enough so that we can fight it and get rid of it. However, on the opposite end of the spectrum, if we have an immune system that is compromised, it is when the immune system is compromised that bacterial infections wreak havoc. So let's talk about the immune system a little bit and its role and how it works to fight off infection within the human body. So as I've stated already, the body has a series of natural defenses that are set in place to prevent germs from entering the body. Truly, what we know is that the body heavily relies or depends on both our intact skin and our intact mucous membrane, right? And so we typically have, our intact skin, which is what we would feel if we were to rub our arms, and then the mucous membranes, typically within the mouth, the nose, the eyes, and these mucous membranes work really hard to keep the germs out, right? But when we're placed in an emergency situation and we have a situation where the skin is damaged and then germs can enter in through those openings, such as a cut or some type of sore, or if the mucous membranes become compromised and germs are allowed to intrude, then truly that creates a situation where an infection can occur, right? And so when we think about the immune system, it has several different basic tools, and the number one basic tool that it has are antibodies, right? And our antibodies and our white blood cells are really the major players in the game, if I could state it that way. They are responsible for fighting off infection. What they do is they're white blood cells that travel around the body and identify invading pathogens, right? So an invading bacteria or an invading virus. And then once they detect that virus or that bacteria, they signal the white blood cells to gather around it and to release antibodies. And these antibodies really, 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 really are good at fighting off the infection, right? These antibodies attack the pathogen. They either weaken it or they destroy it. And then they typically rid the body of these pathogens. And so antibodies are a good thing, right? They are our natural defense. They're going to fight off the pathogens that have invaded our body. But when the immune system can't fight off the infection and the invading pathogen is allowed to attach and establish itself within the body, causing infection, then we have a problem because it exhausts the immune system and it no longer can fight off the infection. And typically we might get some common signs like our headaches, our chills, our nauseousness, and our vomiting. So if I could ask the question, what is the role of the antibiotics? Truly is to recognize that a pathogen has invaded the body, to signal white blood cells to come along and to destroy that pathogen, right? And if they do this and if they're functioning, then we don't get sick, right? Or we don't feel lethargic and apathetic. So the body's natural response, protective response, typically involves the immune system. However, we as human beings are also born with three different types of human immunity, right? And those are the three that are listed here on the slide: the innate immunity, the adaptive immunity, and the passive immunity. And if I had to define them, I would say that the innate immunity really represents the type of protection with which we are born, right? The term innate immunity also refers to the natural barriers that our body has, such as the skin and the mucous membranes that I've already talked about, the throat and the GI tract, which help to prevent most diseases from occurring in our body. So when we say innate, it is something that we are born with, right? And then on the other end of the spectrum, we have our other two forms of immunity, which are our adaptive and our passive immunity. So an adaptive immunity develops throughout our lives as we become exposed or through repeated exposures to diseases and or immunize against them. So we think about the chicken pox vaccine, we think about the hepatitis B vaccine. So anything that we've had that we will no longer be exposed to or get again. So I'd say like chicken pox. as an example. And then we get our passive immunity, which is represented by the immunity that we gain from external sources, such as from our mother's breast milk to an infant. So something that we've received from someone else. Typically, it's from the mother to the child at birth. So we'll say mother to infant. Why are these immunities important? I think it's very interesting to think about these immunities and think about God's greatness, right? That he would equip us with an innate immunity, something that we're born with, the skin to protect us, that over time, that as we become older and we've been exposed to different things, that our body would be able to adapt, and that it is interesting that our mother could provide certain antibodies to us that would be capable of protecting us for a lifetime. So the puzzle represents this connection between how diseases are spread, right? And so we could say that exposure to blood and other body fluids occurs across a wide variety of occupations. You're choosing to go into the healthcare profession, whether that be athletic training or physical therapy, whatever it may be, you're going to place yourself in a situation where you could be exposed to a disease or a pathogen, right? And so I think it's very important to understand how diseases are spread, right? So for any disease to spread, that includes bloodborne diseases, 4 conditions must be met. And you can kind of see what those 4 conditions are within this picture, but we'll also talk about them more in detail on the next slide. But the one condition that must be met is a pathogen must be present, right? When we say pathogen, we mean a virus and typically a bacteria, right? And then you must have susceptibility to that pathogen. Remember what I said, the immune system is a well-functioning machine. So if it is intact and if it is healthy, then you can fight off most diseases that you're going to be exposed to. However, if it's compromised and you're susceptible, then a pathogen could invade. The pathogen must be high enough in quantity, to overcome the immune system's innate ability to fight off infection. And then obviously, last but not least, you have to have an entry site somewhere for the pathogen to actually enter. Okay, so if we were to sum up the puzzle, we would say that there are 4 requirements for the pathogen to invade and to wreak havoc within the body. And those 4 are: a pathogen must be present, the quantity of the pathogen must be high enough to overcome the antibodies and the white blood cells within the immune system, that a person must be vulnerable to a specific pathology or pathogen, so that in fact the immune system must be weakened in order for that pathogen to cause some type of infection. And then there has to be an entry site. There has to be either an open wound on the skin, your mucous membranes might not be functioning correctly that day, but there has to be some entry site for the pathogen to enter into. So there are 4 different ways that a pathogen can enter a body, right? So we talked about the 4 things that must be present in order for a pathogen to enter the body, but then we need to talk about the ways that a pathogen can enter a body. And those are your direct contact, your indirect contact, your airborne transmission, and your vector transmission. You might wonder why airborne and vector transmission are red, because it's very rare that these two modes of entrance occur. The most common types of ways that pathogens enter the body are direct and indirect. So direct contact really means it's a mode of transmission of pathogens that occurs through directly touching the infected object or body fluid. And so we could say that, for example, if a person has an open wound and it is bleeding and you have a cut on your finger and you touch that wound and you touch that blood, then that would be a means of being exposed to a pathogen through direct contact. On the opposite end of that, we have indirect contact. And indirect contact is a mode of transmission of a disease-causing agent by touching a contaminated object, right? So let's say, for example, you have a patient who has HIV and is bleeding on their hand, and they touch the door, and that door now has the patient's blood. You leave class and you touch that door, and you have an injury on your hand that's open. You could be exposed to the HIV virus or the pathogen that way. So when you think direct, you touch a person. You touch a person that's infected. When we think indirect, you touch an object. So it's an object that you're touching. The other two modes of transmission, or ways that a pathogen can enter a body, are airborne transmission. So the biggest way that you can do this is coughing and or sneezing. Okay, and then you have your vector mode of transmission, which is really truly just a mode of pathogen transmission that occurs when an infectious source, such as like an animal and or an insect bite or sting, penetrates the body skin. So one disease that is most commonly transmitted via vector transmission is deer tick disease, which is when you get a tick that attaches to the patient and starts to deliver some type of virus or bacteria. But these are the four main ways that a pathogen can enter the body. So the first and most common type of pathology or illness that an emergency medical responder can be exposed to is hepatitis. And so when we think about hepatitis, we think of it as a disease of the liver. Some define it as an inflammation of the liver. And the way we know that it's an inflammation is this latter part of the hepatitis, which is an itis. And itis always represents some form of inflammation. When we think about HEPA, we think of liver. So ultimately, hepatitis is the inflammation of the liver. I think some of the important things to know about the liver superficially is that it stores and it secretes bile, right? And so we think about an inflamed liver, it loses its ability to store, and to secrete bile. Typically, hepatitis as a whole, it caused by some type of alcohol abuse and or drug use, but that isn't always the case. Sometimes you can get hepatitis by eating food. You can get hepatitis from being exposed to someone's blood, and you can also get hepatitis from, again, chronic overuse and abuse of alcohol and drug use. And so I've highlighted hepatitis B because this is the one that we will come into contact with most in the emergency medical response field. However, I think some things you need to know is that you can be exposed to hepatitis A. Typically, hepatitis A is transmissible by eating some type of prepared food by someone with hepatitis A, and that person didn't wash their hands. You can also get it from like changing a diaper of a child and getting some of their feces on your hands and then not washing your hands and either rubbing your eyes or rubbing your mouth. Or the biggest one, which we would see like if we're going to Mexico, is drinking contaminated water. So you have to be careful if you're taking that trip across the border to TJ, because you can be exposed to hepatitis A. On the opposite end of that spectrum is hepatitis C. Hepatitis C is the one that we typically will observe in patients who have abused and used alcohol. And so what we typically see with these patients is that in addition to all of the other common signs and symptoms with hepatitis B, there is no treatment for hepatitis C. So these patients will go on to die. Some of the interesting statistics about hepatitis C is that it is the leading cause of liver transplants within the United States. So that brings us to hepatitis B, and we're going to talk a little bit about that on the next slide. So hepatitis B is a severe liver infection caused by the hepatitis B virus, or what we'll call the HBV virus, not to be confused with HPV, so the HBV virus. So it's a severe liver infection that, if exposed, can be fatal. So what we know about hepatitis B is that it is very severe, that it can be fatal, and that it can be this pathogen can sit within the body for about 6 months before the symptoms even start to appear. So when we think about this as a clinician, is that this pathogen, this virus has been sitting in the body for 6 months before we even start to manifest symptoms such as nauseousness and or sweating or dizziness, right? And so one of the problems with hepatitis B is that by the time it is caught, typically the pathogen has been able to replicate itself so much that the immune system just cannot fight it off, that any antibiotics that might be taken just do not work. So the most effective prevention to hepatitis B really is healthy habits, or practicing healthy habits. The number one way to reduce your risk of exposure to hepatitis B is always washing your hands thoroughly before preparing food, after using the restroom, obviously, and if you're going to be changing diapers for your nieces, your nephews, someday your kids, after you've changed the diapers as well. Hepatitis B is very fatal, as I've mentioned. Some of the signs and symptoms can be, a list of them could be, but not limited to, fever, fatigue, abdominal pain, loss of appetite, nauseousness, vomiting, and joint pain. And some of your patients may have dark urine. Again, this is because of the liver's inability to store, secrete, and make bile. And then later stage symptoms include jaundice. So what is jaundice? Jaundice is just a yellow appearance. Remember that as the liver becomes inflamed, it becomes less effective at secreting bile, and because the bile begins to store up, your patient starts to have this yellowish appearance. Another common disease that emergency responders can be exposed to is tuberculosis. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. The bacteria typically attacks the lungs, or what we'll call the respiratory system. And if it does attack the respiratory system or the lungs, it could become fatal. However, it is easily treatable. One of the biggest things is that it is transmitted via airborne. So what that means is someone could cough or sneeze, and you could be exposed to this particular pathogen. Some of the interesting things about tuberculosis is this is why they recommend that infants who leave the hospital not be exposed to very many people within the earlier stages of their lives because of the risk of tuberculosis. Some of the common signs and symptoms that we see with tuberculosis, because it is a respiratory system pathology, is things that are going to be associated with like coughing, shortness of breath. You'll have extreme weight loss, some night sweats, and fatigue, and it can go undiagnosed and or present like some of the other diseases that we've already talked about, such as your hepatitis B. It can also be misdiagnosed as HIV, which we'll talk about on the next slide. TB must be treated properly, or it could lead to death. So what do you think the treatment would be? Well, obviously it's probably some sort of antibiotic for these patients. So that brings us to HIV, which pretty much is the virus that causes AIDS, acquired immunodeficiency syndrome. We all probably have learned a little bit about this. I think it's important to understand the concept behind HIV, right? And HIV is a virus, right? It's going to attack our white blood cells and our immune system, right? And because it does that, it really destroys the body's ability to fight off infection, right? It weakens the immune system, and because it weakens the immune system, our antibodies cannot go in and invade that virus and destroy it and or weaken it. And so because our immune system is so compromised, patients with HIV and or AIDS are really susceptible to what we call opportunistic infections, right? And so what we think about this is it's other infections that occur because of the initial infection. So patients with HIV and AIDS often suffer from tuberculosis, severe flu, and cold-like symptoms, right? And so we also know that some of the signs and symptoms associated with HIV include, but are for sure not limited to, fatigue, fever, night sweats, right? Unexplained weight loss, swollen lymph nodes. And so when we look at this slide and we look at the tuberculosis slide, we can see that some of these are very similar signs and symptoms, such as the severe fatigue, the fever, and the night sweats. One of the interesting things about patients who present with HIV and or AIDS is this little phenomenon down here. What you see on this patient are these little dark black dots, and they're called Carpi sarcoma, right? And what they present and they look like are just little welts on patients. In our African American patients, they'll present with dark black spots, and in our Caucasian population, more probably like dark brown and or dark red spots. So these are some of the signs and symptoms that are associated with HIV, the pathology, and another pathogen that, again, we as emergency responders could be exposed to. So now that I've told you about the diseases and the pathogens that you could be exposed to, I think I want to give you some tools to help prevent exposure to a pathogen. And so when we talk about prevention, the big deal is understanding the standard precautions that are available to you. And the number one standard precaution that is available to you truly is personal hygiene. But we'll look at this list of 4 precautions down here. The first one is, the overall group of things that we'll call as BSI, or what we'll refer to as body substance isolation materials. These are things that are going to protect you against exposure to pathogens. So on that list of BSI are your personal protective equipment, which we'll talk about in detail, personal hygiene, which has actually been listed as the #1 way to prevent exposure to a pathogen. Then we've got our engineering and work practices control, which is when you're working for a facility and you become exposed. And then last but not least is ways to clean and disinfect your equipment. So some of you guys are going to be clinicians, so you'll learn ways to disinfect your materials in your clinic. So first of all, you need to know that there are immunizations that are made available to you. The first one is the hepatitis B vaccine or vaccination, which all of you should have had prior to coming to Point Loma or are in the midst of taking, but that is a 3 or a 2-shot series, right, that is aimed at protecting you against developing the hepatitis B virus, right? So your employer and or your parents are responsible for getting you that shot. Should you become exposed to hepatitis B, however, you have to be evaluated, and then you have to be a follow-up with a physician is also necessary. So if you work for an employer, what is the employer responsible for? If you are exposed while on the job, the employer is responsible for all healthcare costs that might be incurred, and they have to provide all of these things to you at a reasonable time and place, and it has to be with a licensed physician and or a healthcare professional. So what is personal protective equipment? It is the most important thing that you as a first responder could use. So personal protective equipment is something that would protect you from coming into direct or indirect contact with some type of contaminated material. So direct or indirect contact. This could include but not be limited to gloves, which we'll talk about how to remove them in class and in lab. And then you could use gowns, masks, eyewear, resuscitation devices. Before you enter the scene, if you have any open wounds, you should cover those cuts, those wounds, those scrapes, so that you do not become susceptible to a pathogen through an open wound, right? And so personal protective equipment is truly just equipment that is designed to protect you as a first responder. Hand washing is also another personal protective equipment that we have. So personal hygiene is a big deal. After you remove your gloves, after you remove your gowns, your mask, please make sure to wash your hands. Washing your hands with soap and water. And research is showing that not only soap and water is as effective at removing bacteria and virus, but also antibacterial gel after you've washed your hand. 99% of bacteria and viruses are removed from the hand when you wash with soap and water and then finish off with antibacterial gel. Big deals, avoid eating and drinking and applying medication when you're working with a patient. I had one student one year working with the patient, had bloody gloves on, and then picked up a Snickers bar and proceeded to eat. They didn't really think about the fact that they had these bloody gloves on. Well, you just exposed yourself to some type of pathogen. So always make sure that you take off all of your EMR materials before you start to do things like eating or drinking or applying some type of makeup within the field. So how do we minimize the risk of exposure in the workplace? Big deal is never recap your needles. You never want to recap them because if you recap them, you increase your risk of being exposed to some type of needle stick injury. We always want to place sharp items in a puncture-resistant container, and those puncture-resistant containers are typically red. And then last but not least, you always want to provide or have some type of antibacterial soap and or antiseptic wipes or hand cleanser. Very briefly, if equipment does become infected, we have to disinfect it. And so the standard of care is 1/4 cup of bleach per 1 gallon of water. If you're dealing with leather items, then typically warm water and soap will disinfect just as well. Refer to your book if you really want to know about disinfecting procedures further. So for homework, I want you to complete the following charts and questions and be prepared to turn these in typed to the professor in the next class period. Homework question number 1, I want you to describe what you would do if an exposure occurs. So if you become exposed to a pathogen, what you're supposed to do and what is the protocol. Please consult your text for the appropriate answers. This should be about a paragraph or two. You're more than happy to list if you'd like. For this homework question, I want question, I want you to give 3 examples or possible incidences in which bloodborne pathogens enter the body. So 3 examples of how they can enter the body through direct contact, and 3 examples of how they can enter the body with indirect or through indirect contact. For this table, I want to know, would you or wouldn't you? I've given you several different examples in this table of tasks that you might be performing. So, for example, bleeding control with squirting. Would you put on disposable gloves? Would you put on a gown? Would you put on a mask? Would you put on an eyewear? So create this table within Word and put X's in each of the boxes for which you would use any of these particular materials. So this is the end of your lecture on Chapter 2. I hope you learned a lot, and I look forward to the next lecture.